Well, one, Robert, because he had regressive autism, Robert did not chew and swallow until he was almost 5 years old. Robert had 2.5 years of intensive feeding therapy. And Robert, because he's really bright and he's in there, Robert figured out, because he had this severe gastroesophageal reflux, and he had bronchoscopies and endoscopies, which is basically a tube placed down through your nose down into your esophagus. And he had this surgery which closed the sphincter around his esophagus because the food would come back up. With that said, having done all of the protocols and taking all the meds, and they would all become placebos after a time, clearly there was some damage done to Robert's esophagus, and it burned. Chewing and swallowing hurt. Robert figured out he would take the food, you would give him food, and Robert would masticate it in his hand and then suck it through his fingers. I had bought a masher, like a strainer. It's a food thing. It's like a little, it looks almost like a Ziploc bag. And you mash the food up in it, and it basically acts as a sieve. He didn't like that. He didn't like the texture, because I told you he's got sensory integration issues. Robert is hyper-oral sensitive, so he did not like anything in his mouth or touching his mouth. But he would masticate the food, suck it through his fingers, and that's how he got his nutrition, because we had to wean him off the bottle, because he was drinking a thickened bottle. That's how he got his nutrition. But it's inappropriate for a child of 4 or 5 years old to drink a bottle. And when you're dedicating yourself to, one, having a happy life, you can't drink a bottle at 35. So, of course, Robert's going to have to chew, because that's what you do. You're going to get weaned off the bottle. And in weaning him off of it and him learning how to chew and swallow, took 2.5 years. 2.5 years. Potty trained in a minute. Never wet the bed. Could not chew and swallow. That's what I'm talking about, And then there are parents who had absolutely no feeding issues, whose children still wear diapers, and they're 13. Is one better than the other? Is one challenge